Hello friends, today we will discuss about lumbar vertebrae. Lumbar vertebrae are located in the lumbar region. They are 5 in number. Intervertebral disc is present in between two adjacent lumbar vertebrae. Types of lumbar vertebrae: typical lumbar vertebrae and atypical lumbar vertebrae. L1, L2, L3, and L4 are typical lumbar vertebrae. L5 is atypical lumbar vertebrae. Features of typical lumbar vertebrae: the body is large, and is wider from side to side than from before backwards. The height of the body is slightly greater anteriorly than posteriorly. The vertebral foramen is triangular in shape, and is larger than in the thoracic region and is smaller than in the cervical region. The pedicles are short and strong. The laminae are short, thick and broad. They are directed backwards and medially. The spinous process is quadrilateral in shape, directed almost backwards and slightly downwards. The transverse process are thin and tapering, and are directed laterally and slightly backwards. The superior articular process lie farther apart than the inferior articular process. Each process bears a concave facet facing medially and backwards. The inferior articular processes lie nearer to each other than the superior articular process. Each process bears a convex facet facing laterally and forwards. Features of atypical lumbar vertebrae: the transverse process are thick, short and pyramidal in shape. The distance between the inferior articular process is equal to or more than the distance between the superior articular process. The body is the largest of all lumbar vertebrae. The pedicles are directed backwards and laterally. The superior articular facets look more backwards than medially, and the inferior articular facets look more forwards than laterally, as compared to other lumbar vertebrae. Identifying features of lumbar vertebrae: massive and reniform body. Absence of costal facets on the body. Presence of accessory and mammillary process. Thick quadrilateral spinous process. Attachments, and relations of lumbar vertebrae. The upper and lower surfaces lie contact with the intervertebral discs. The upper and lower borders give attachment to the anterior and posterior longitudinal ligaments in front and behind, respectively. Lateral to the anterior longitudinal ligament, the right crus of the diaphragm is attached to the upper 3 lumbar vertebrae, and the left crus of the diaphragm to the upper 2 lumbar vertebrae. Behind the line of the crura, the upper and lower borders of all the lumbar vertebrae give origin to the psoas major. Across the constricted part of the body on either side, tendinous arches are attached. Erector spinae and multifidus muscles are attached to the spinous process of lumbar vertebrae. Ossification. A lumbar vertebrae ossifies from 3 primary centers and 7 secondary centers. Clinical correlation. Sacralization of the 5th lumbar vertebra. It is the fusion of the 5th lumbar vertebra with the sacrum. The fusion may be complete or incomplete. The transverse process of L5 may articulate with ala of sacrum and or ilium and compress the L5 spinal nerve. This condition occurs in about 5% of normal individuals. Spina bifida. It occurs due to non-fusion of 2 halves of the vertebral arch. In this condition, the meninges and spinal cord are exposed and may herniate out in the midline through the gap. Spondylolysis. In this condition, there is a separation of body of 5th lumbar vertebra from vertebral arch bearing inferior articular process on one side only. Inferior articular processes of L5 vertebra normally interlock with the articular processes of the sacrum. Cauda equina syndrome. It is caused due to compression of cauda equina leash of a nerve roots of L2 to S1 around the filum terminale. Clinically, it presents as flaccid paraplegia, saddle-shaped anesthesia, late bladder and bowel involvement,